My name is Cindy McGonigal, and my position is practice manager. I'm also an RN. I work at Brown Square Health Center, and I've worked for Jordan Health Center for almost 26 years. People come in, and I know I've been screening at the front door a lot, and we check people's temperature when they come in. We have a series of questions that we ask them. Have they had a fever, a cough? Have they been around a sick individual that may have been exposed to COVID? Have they lost a sense of taste or smell? I mean, it's pretty comprehensive screening that we do for anybody that walks through the door. So in this time with COVID, we are on the front line here in our community, testing now, which is amazing that we can do testing for our patients and tracking them and their family members and so forth in this community. And that, we're still seeing patients for regular issues, regular conditions, hypertension, diabetes, all that. It still is present in our lives. So we can't just put our chronic illnesses on hold because we're afraid to get COVID. Same thing with children's vaccines and child exams for babies and pregnant moms and stuff like that. Life goes on. We at Jordan, we have opened our respiratory clinic for our patients who are the most underserved in the county, and so they do have that opportunity to be tested. We also have the coronavirus hotline, which is manned by RNs to screen patients who think they may have COVID, and then to link them up to either the health department or a local testing site. I've come up with a kind of little thing I'm doing here at Brown Square. I call it COVID Cares cards. And I've purchased some cheap cards from Amazon that are like thinking of you or get well, I hope you're having a great day. So I sent an email to all my staff to give me names of people who they think could really be have their day brightened by receiving one of these cards. So I sent out about 20 so far. So I have to replenish my stock, but I got some really good feedback from one of our patients. She's in her 70s and she has cancer. She was the first one I sent the card to, and she came in the other day for, I don't even know why. I think she had an appointment, but it got rescheduled, but she showed up anyway. And I was like, wow, how are you? And she said, oh, I got that card you guys sent me. She said, it made my month, she said. And she said, I showed it to all my friends and they just thought it was fabulous. And to me as a nurse and as a human being, that made me feel so good that, somebody else had a smile on their face from a small little action that we did here. And I have to give kudos to all my frontline staff. I have my receptionists, they're in the front line having people come in, my screeners at the front door, my nurses, my outreach people, the clinicians themselves have bent over backwards to provide excellent care for the patients, my care managers, my interpreters. I think that the community, I think they already know because Jordan's been around for over 50 years now. They know who we are. I think that I would like to see more engagement with talking with people, what they think about COVID. Like if I were at the front door and I said to a patient, how do you feel? I don't have time to really do that at this point in time, but getting their view of it and what are they going through and what are their needs.
My name is Lynn Mall. I'm the registered dietitian at the Jordan Center, Anthony Jordan Health Center, and I provide care in support of many of the departments across Jordan, especially family medicine and pediatrics. It's interesting because usually people come into the office, but all of my patients I've been communicating with over the telephone, and in some ways it's much more effective. But I think that some of them in particular really like the one-on-one aspect of coming in and talking to me and having a lengthy appointment. With the telehealth visit, we can get down to a little bit more specifics in some ways. So for instance, they're at home. They can open up their cupboard and take out a can of beans, and I can teach them how to read that label on the back of it or on any package that they have and really put it into effect, drive home like what it is that I'm talking about when I say low sodium or high fiber or low fat, and they really see the differences. You know, like I said, it's still important to have those one-on-ones, but they don't all have to be one-on-ones. They can be, okay, so now you're at home and let's, you know, talk about what type of exercise you can do at home. You know, what kind of space do you have, and how can you cook?
I am Giovanni Canales, and I am the new patient registrar at Brown Square. I am Jomar Canales, Giovanni's twin, and I work in Brown Square, and I am a receptionist in the front desk. I think with the epidemic that we're facing, I'd like to say that I'm very thankful of the place we're in. We're very thankful to be part of the Jordan family. Our patients are experiencing a lot of difficulties when it comes to, you know, their mental health and their health overall, that have been affected. I think we're playing a huge part in their lives. We as you know, the front end usually speak to our patients all the time, and we suffer with them. You know, when they are having a bad day, we suffer that with them, and I think being there for them is really important. A lot of people are being anxious, are going through a lot, and they get a sense of uh, comfort when we speak to them and see them on a daily basis. And also, we've been also calling people over the phone, and it is a blessing just to be able to talk to people over the phone, because some people have not been able to come out their houses because of the quarantine. So having to talk to them, making sure that they're all right, that they're safe. It is also good to let them know we are here for you. Yes. And also a way to touch bases with them, because they need that. They need that. So it is a challenge for us to stay in touch with all of them, but we've been doing it because that's what we're here for, to serve our community and bring quality care. We're doing good overall. I feel comfortable coming into work knowing that we're being protected, we're being provided equipment, PPE equipment. We're doing things based on protocols. And overall, I like what they're doing. Yeah, I feel safe. I honestly feel safer coming to work than actually going to the store. Yeah. So it is awesome that they're doing their job. They're doing their part. They're taking every precaution, and they're making sure that everybody is safe when they come in into this facility. So I feel great. I feel good. I like to say what Jordan has been saying for the past 50 years. We're for the community. We're there for them. Our doors are open and will remain open. This is a family, and we care for our community.